Preload in simple terms means how stretched the heart muscle is before it contracts. More specifically, it is the amount of blood in the ventricles at the end of diastole, which means when the heart is relaxed. Imagine a balloon. The more air in the balloon, the more stretched it becomes, and less air means less stretch. The heart works the same way. The more blood returning to the heart means more preload, lesser blood returning means less preload. Anything that sends more blood back to the heart will increase the preload, such as IV fluids, blood transfusions, high sodium intake, which will cause fluid retention, heart failure because of the blood backing up into the heart. Now, anything that reduces blood return to the heart will decrease the preload. These include vasodilators, diuretics, hemorrhage, dehydration. Medications like nitrates dilate the veins, which causes blood to pool back into the veins, hence decreasing the blood returning to the heart. The blood returning back to the heart is referred to as venous return. The lower the venous return, the lower the preload. Why is this concept important for nurses? Because it affects cardiac output, workload on the heart, and oxygen demand. So if there is too much preload, that can cause fluid overload and pulmonary edema. When the preload is too low, you're not going to have enough blood, which will cause hypotension and poor perfusion.
Let's test your knowledge on this concept and try a few NCLEX-style questions. Question 1. A nurse administers nitroglycerin to a client with angina. Which action explains how this medication relieves chest pain? Option A, increases cardiac contractility. Option B, decreases preload by dilating veins. Option C, increases afterload to improve perfusion. Option D, increases heart rate to improve oxygen delivery. Pause the video and think carefully before answering. Correct answer, B, decreases preload by dilating veins. Rationale, nitroglycerin is a venous vasodilator. It causes blood to pool in the veins, decreasing venous return to the heart. This lowers preload, reducing the heart's workload and oxygen demand, relieving chest pain. Question 2. Which client finding indicates an increased preload? Option A, dehydration. Option B, diuretic use. Option C, pulmonary edema. Option D, orthostatic hypotension. Pause and think before answering. Correct answer, C, pulmonary edema. Rationale. Pulmonary edema occurs when fluid backs up into the lungs, often due to heart failure, causing increased preload. Question 3. Which intervention? Would the nurse expect to decrease preload in a client with heart failure? Option A, administer IV fluids. Option B, place the client supine. Option C, administer a diuretic. Option D, encourage increased sodium intake. Pause and answer. Correct answer C, administer a diuretic. Rationale, diuretics remove excess fluid, reducing circulating volume and decreasing preload. Question 4. A client is experiencing hemorrhage. Which hemodynamic change does the nurse expect? Option A, increased preload. Option B, decreased preload. Option C, increased afterload. Option D, increased cardiac output. Pause to think. Correct answer, B, decreased preload. Rationale, hemorrhage causes loss of blood volume, leading to decreased venous return and decreased preload. NCLEX tip, low blood volume are low preload. Question 5. A client with acute heart failure has crackles, jugular vein distension, and shortness of breath. Which medication is the priority to reduce preload? Option A, metoprolol. Option B, furosemide. Option C, digoxin. Option D, epinephrine. Pause to answer. Correct answer, B, furosemide. Rationale, furosemide is a diuretic that removes excess fluid, reducing venous return and lowering preload, which helps relieve pulmonary congestion. Great job! Keep practicing these concepts and they will become a second nature.
If this explanation helped you think instead of memorize, subscribe for more nursing concepts made simple.